thank you to everybody for joining us at such short notice. And welcome to the Bay Area Global Health Alliance emergency briefing on the situation in India in terms of the COVID-19 pandemic. But the focus we are going to take is also and mainly on how we in the Bay Area can connect or stay connected to existing effective responses. We want to take a step forward in terms of what we can do and what we are already doing. My name is Purnima, and I'm a board member of the Bay Area Global Health Alliance. For those who do not know enough, let me tell you just a little background about the Alliance. We are a group of academic institutions, biotech, tech, and other companies, and nonprofits and community-based organizations located in the San Francisco Bay Area. We're all committed to improving the health of everyone around the world, and that's why it's called the Global Health Alliance. Our executive director, Sarah Anderson, who you will see, and many of my fellow board members, including our board chair, Mary Pittman, who is president and CEO of the Public Health Institute. I can't see her, but I know she's there.
Good morning.
Good morning. And Vice Chair Hema Buddharaju, who's the Director of Product Management at Google. Hema, are you there?
Yes. Okay. Hi, everyone.
Are joining us on this Zoom briefing. Thank you so much and welcome to you. In addition, I want to tell you that this is only our first briefing. We will be monitoring the situation in India closely and provide our 50+ members of the Alliance regular updates. And you can probably see some of these on our website. Many of our members are already working with partners, and affiliates to support on the ground emergency efforts. We're also polling our members to find out what they're doing because things are changing on a daily basis, as you know. We will share the poll with you, the responses. They're still coming in, but if you haven't responded, please do and send us that information. We will also post later on organizations and institutions that can receive funding from abroad. We have collected that from different member organizations that have very kindly provided it. Just to give you an introduction, I really don't need to tell this group about how grim the situation is in India. I saw the statistics this morning, and so the Center for Global Development says 1 in every 4 persons in India is infected. And as of 2 days ago, India had 20 million cases with, about 215,000 deaths. The data is, of course, changing on a daily basis, mainly because we have a new variant we're dealing with, which seems to be, we're not sure, and that's what health experts are looking at, seems to be more deadly, as if I can use that word. It seems to have more likelihood of fatalities. We don't know that. That is being looked at. The problem with reliable data is that, the data collecting capacities are already being stretched in a situation where there is a pandemic. And there are already limited data gathering capacities in certain parts of India, which happens anywhere. So, and there is a time lag, as you know, between somebody getting sick, somebody going for a test. All of those time lags have to be taken in. So most health experts say that this is a gross underestimation, but we have to move ahead based on what we know. Shortages of COVID tests have added to the problem. And of course, as you know, vaccines, India is supposed to be producing vaccines, but what right now the situation is there is a shortage. And only 9.3% of the population has received the first dose. Second dose, it's only about 2.1 that they're fully vaccinated. So there is a serious problem in terms of vaccinations as well. Each of us, on the other side, I want to emphasize, has somebody in India, either family member, friend, or work or current work colleague that is suffering the consequences of this pandemic. Today morning, I got a message from somebody who had lost a friend. And it just continues to go on, and the media coverage has been pretty brutal and very, very graphic. Several hospitals lack equipment. They lack beds, first of all, to treat patients. They don't have enough healthcare workers. They're leaving families to take care of their loved ones, which means that they get infected, which is not what way you want it. And equipment and essential supplies are urgently needed, including oxygen cylinders, ventilators. I don't need to tell this group, most of you know what those shortages are and are working on them. What is particularly staggering is to watch how the cremation grounds are, not falling short, and the equipment there too is becoming difficult to get hold of, which means saying goodbye to somebody you love has become an even more difficult process. Finally, I want to just say that the current variant is going to take us time to, sort of grapple and understand the realities of the new variants that are hitting India in the second wave of the pandemic. Because as I said, it's believed to be more transmissible, but we don't know that. If it's believed to be more deadly, again, that is another question that health experts are looking at. But the current picture tells us things are not going well, and things are really at a serious, alarming stage. This is a national, it's a regional, and I would say it's a crisis of global proportions. The world is starting to respond, reach out to India to help, but we have a long way to go before India reaches any plateau. I heard some good news about Maharashtra, but that plateau is, I don't know how long it'll last, and I hope it lasts, and I hope it spreads to other parts of India. So let me move on to our speakers, who are people who are well-known, well-reputed, and thank you so much for agreeing at such short notice to do this. They're going to tell you about, the work they do and what we could do. We have Stanford and Pat, as I said, represented, and let me just introduce them. Anurag Mairal, who's the Director Global Outreach Program of Stanford Byers Centers for Biodesign, and he's going to share with us what he does, but he's going to share with us also the best ways institutions and individuals can support existing responses. Anurag, we hope you can also tell us what's happening in the Bay Area in terms of the diaspora and other responses with which we know you are well involved. I'm deeply grateful that we are being joined by Mohammed Ameel, who's the head of primary healthcare technology and innovations of PATH India. And we know, Ameel, it's 12 and a half hours ahead for you, so it's kind of nighttime, so thank you for taking the call. Ameel is also a former senior consultant at the National Health Systems Resource Center, Health Technology Division, which is also a WHO collaborating center. So he's worked partly also for the government, and he's worked at nonprofits. He really knows the field very well. We are deeply grateful to you for doing this, Ameel. We hope that you and your family stay well, because that's the important thing right now, that we keep ourselves well as our loved ones. Let me tell you a little bit about the question and answers session that we will open up as soon as we finish. Each of the speakers will speak for 10 minutes. We've decided to do that to give people an opportunity to ask questions. When we open the floor to questions, please use your chat and put your questions in the chat, because we will have Ben and Sarah look at those questions. As you know, Ben Plumley is the senior advisor to the Alliance, and many of you will know him as the host to A Shot in the Arm podcast. Ben will, look at the questions and read them out and, to me. And then we'll go ahead from there, decide who will address them. So over to Ameel. Please go ahead. Thank you.
Thank you. Thank you so much for inviting me. And thank you for a wonderful introduction, I must say. Um, Maybe I'll begin with kind of background of where we are. Uh, India records close to 3.8 lakhs COVID cases, close to 3,700 deaths in past 24 hours. Fatality rate is over 1% now, and we have crossed the grim milestone of about 20 million cases on Tuesday. Uh, Registering a steady increase, the active cases have increased considerably now. And talking specifically about oxygen, which has been a crisis in the past couple of weeks, we were producing about 7,200 tons of oxygen a day, and only 15% was required as medical oxygen in the pre-COVID days. Now, industrial consumption has come to zero as the entire capacity has been converted to produce medical oxygen. Even during the peak of the first COVID wave in India, maximum demand was close to 3,000 ton. But now medical oxygen consumption in India has shot up more than 8 folds from usual levels to about 7,200 tons per day this month. Most of the oxygen manufacturing units are concentrated mainly close to steel plants, the main consumers of oxygen, and that's also becomes a supply chain issue. So from 6,000 metric ton a day in August 2020, the domestic production of medical oxygen has been ramped up close to 9,000 metric ton by converting high purity industrial oxygen to medical use within a month. Although measures and efforts have been amplified, but the process is slow and it is taking time to see the translation of these efforts into impact on the ground. And it has had a significant impact on health infrastructure. So India's spending on healthcare, we know, has been less than 2% of its GDP. And from the numbers published by the government in 2019, there's one doctor per population of close to 1,500 people in the country. And this underinvestment somehow, unfortunately, in the public health system is a running issue, which has kind of stretched us in the sudden surge of COVID cases. Hospitals have also faced the wrath of this. But immediate measures are put into scale up oxygen capacities and medical infrastructures. Uh, Trains and military aircrafts are also being pressed into action to speed up the transport of oxygen. And with this rising uncertainty due to the COVID second wave, there's a sense of panic and disorientation for the population that is very different from what was experienced in 2020 due to severe burden on medical infrastructure.
Mm.
Many Indians are now are kind of going through such a mental stress. Even our personal experiences, many of our colleagues, families, friends are down either caring for themselves or their family members. Even those who are physically healthy are now living in fear, anxiety, or maybe a sense of foreboding that COVID will reach their doorsteps or that of someone they know. But this is also the time to mobilize and respond to the crisis. At Path, we've stepped up in this grim situation to provide support to state governments to deal with oxygen shortage crisis. Uh, Current priorities, if you look at this, has put huge pressures on the health systems. And most of us have concentrated so far developing new vaccines or investment in the PPE
Mm.
kits or the ventilators. Now is a time that we collectively work on the requirement of oxygen access, which is the need of the hour. And to tell you about what we've done since the beginning of the COVID pandemic, the path has worked across Indian states of Maharashtra, Karnataka, and Punjab to strengthen respiratory care with the goal of ensuring that medical oxygen is available for COVID patients and providers when and where it's needed. So, what we've worked upon is rapid demand quantification, baseline assessment, constituting district level committees for monitoring and coordination, supporting procurement and use of respiratory care products, recommendation on equipment selection and placement, site readiness and preparation for oxygen generation plants, technical assistance, supply landscape, and training healthcare workers on rational and hygienic use of oxygen. Over the last couple of months, we have been successfully we've successfully supported setup of 21 oxygen generation plants across these three states, which is the most optimum medium and long-term solution to help states become self-sufficient in oxygen in the long run. Building on this experience, the path India has received emergency support from institutional funders like BMGF and USAID to accelerate our support to the states and intensify our activities on the ground. Under these grants, we are supporting urgent deployment of PSA oxygen generation plants in additional states and are providing rapid technical assessments to states, local governments on supply chain, procurement, and equipment. So these for the newer states that have been added, our key activities are around procuring oxygen concentrators in 4 states, procuring oxygen generation plants for for 2 states, and providing technical assistance for installation of over 500 PSA plants across 9 states for medium to long term support for oxygen needs. We are also supporting on logistics, supply chain, COVID-19 surveillance support to the national government and state governments. We believe that the number of path supported states will continue to grow as the cases keep rising. To immediately support these states, we've put together a path COVID-19 emergency oxygen response task force from various project teams. So coming on to the main point, how can the people on this call in this group can help? uh, and this is important for us to discuss in the last the 4 minutes that I have. So as of now, many donors are providing oxygen concentrators, and state governments and national governments are also procuring oxygen concentrators, and these can meet the immediate need of oxygen for mild to moderate cases, and therefore it is great to see the attention being paid to procure such concentrators for India, especially when there is a shortage of oxygen concentrators in the market. Similar efforts are being put into establish PSA plants at healthcare facilities, and both these options help to improve production of oxygen at hospital sites and reduce their dependence on suppliers and other sources. Unfortunately, PSA plant suppliers, both importers and Indian manufacturers, are really stretched and are unable to deliver on their commitments. Any support to them would certainly be very, very highly appreciated. Also, going forward, the challenge is not only production of oxygen, rather, it is also about bringing oxygen in a consumable form to the hospitals. There are only a finite number of oxygen tankers and cylinders around. So, the logistics of refilling them and bringing them to the destination is a severe bottleneck. The main issue is supply chain, as liquid medical oxygen has to be transported in cryogenic tankers, which normally cater to a 200-kilometer radius. But with this increased demand, even in remote areas, now these tankers cater to over 1,000 kilometers radius. India had only 1,200 such tankers before the current crisis. And so now we're kind of importing around 100 of those tankers to transport the liquid medical oxygen. So to balance the different efforts of generation at site in the hospitals and storage at the hospitals, my suggestions would be to the alliance members to support the setup of cryogenic tanks at hospital sites other than supporting the PSA plant generators. Uh, and also another area of support would be helping with the procurement of cryogenic tankers to carry liquid medical oxygen to distant sites, so that healthcare facilities in smaller town can also have adequate stocks of oxygen. Members could possibly also support setting up cylinder refilling stations, which are really stretched because now patients are being treated at home due to unavailability of beds in hospitals, which most of these refilling stations were not prepared to handle customers outside hospitals. So I believe that the focus on oxygen triggered by COVID-19 will lead to wider availability of medical oxygen, which can be used when the pandemic is over to help patients with pneumonia, malaria, sepsis, and other ailments that require oxygen therapy, and make our hospitals self-sufficient in this regard. So with this, I'll pause and pass on back to you. Thank you so much. Yeah.
Thanks a lot, Ameel. Really appreciate that candid, um, description of what the shortages are and where the help is needed. There is, Ben, is there a question from anybody yet?
Yes, Purnima, a question came in saying that an Indian doctor went viral overnight, saying that most of the ways to ward off COVID are accessible only to the affluent. Many Indians won't be able to do any of this. How relevant are the classic COVID control measures for India? It's not feasible for many citizens to socially distance, have regular access to clean water to wash their hands, and stay at home because they have to work. Is a shutdown really possible at all? What else should the country be doing? And that is for Ameel.
I don't think so. The question is very relevant to the work that we do. We're hardly working around the lockdowns measures. So maybe I should be passing this question here. But in
No,
case
Ameel,
anyone else in the panel would like to answer, and that would be great. Yeah, thanks.
Ameel, you don't have to feel compelled to respond to a question, but it is a concern that is commonly expressed by many people, that how is it going to be feasible to exercise what India did the first time around, which was a very tight lockdown? Would that be possible again? Because even the first time it was hard and the government had to work very hard in order to get it to be implemented. And now it's even more difficult because of all the other issues that have been identified by the person who's asked the question, that people don't have access to this. They need to go to work, and there are these issues. So this is a kind of expression of frustration of how people are feeling, that if you want to help people, how are they going to get access? How are the poor going to get access to this? For example, let me ask a question based on what has been said. If you have to get an oxygen tank, or you need a ventilator, the first person who's likely to get it, is what I'm understanding from this question, is that a person with wealth and connections is more likely to get it than a person who's not. And I can tell you, I've heard some personal experiences of this kind. So how can one get around that? Can organizations help in any way? Can this be monitored to make sure that the poorest of the poor also have access to these facilities?
So yeah, so I think our Prime Minister has also been very, very clear this time that states should really consider the complete lockdown as the last resort. And the way the COVID cases has risen and the shortages of hospital beds or oxygen we've seen, even the rich are not getting, and that's a very, very fair point. I don't think so there's a
Okay.
biasness COVID is doing. At least I think COVID has been biased to the rich and urban class more than the rural population. So I think we people sitting in the metropolitan cities must be complaining more here. Having said that, I think on a serious note, there is a need to strengthen our primary health system. Had we invested in the primary health centers, if we had pulse oximetry, small oxygen concentrators, small size bedded dispensaries in the primary health centers in the rural areas, I don't think so this kind of population density concentration that we've seen in the metro city hospitals, that we would have been able to divert much better. So COVID very much proves that investment in primary healthcare centers is not only in the primary health centers, but in a comprehensive primary healthcare approach is so very important from surveillance point of view, from outreach, from communications. So it's very, very important. So one basic thing of hand washing, it's the first thing that not only is taught in the primary in public health, but also in primary schools, I think, to begin with. So I think these are very cost effective measures. So if we strengthen our primary health center systems, I think we are able to remove these equity issues, if at all they are there. Yeah, thank you so much.
Thank you, Ameel. There's one more question we'll take, and then we are going to move to Anurag, because we'll run out of time otherwise. Yes, Ben.
Purnima, Geetarao Gupta has a very technical question for Ameel. How exactly can we help from here to set up the oxygen cylinder refilling stations? Where do we send the money to help that effort, or to fund the tankers?
Yes, I think this is a very, very good question in case you this needs to be set up. So I know there have been investments, for example, from USA to a program called Samrid, where they are looking at funding uh, and this could be any form of funding. These smaller players who have invested in oxygen generation plants or in refilling stations, fund tankers. So I think the best way would be to connect to such institutions that are kind of strengthening such players in setting up such plants. And this is a work in progress. So I think it's a good time to enter that. Then secondly, the state governments and the national government, federal governments are also making such efforts. And there are various ways of contributing to those the government accounts there's a PM Cares fund as well, through which this could be done. So for example, PM Cares is setting up oxygen generation plants in each and every district. So these are also some of the mechanisms where one could contribute. But certainly this is a question where not much thinking has gone into, and this could be maybe discussed separately. Would be very happy to take this forward. I'm glad that somebody took so much of interest in this. Yeah, thank you.
I think that was my sense when I heard the question, that I think this is the focus of our where we want to take this briefing to. How can we help? And I think the Alliance will have to develop this a little bit further in terms of pointing to organizations that can be assisted, sending out lists maybe of organizations that can be assisted to do exactly the things that Ameel has said, because they're all over the country and it's a big country. But we need to have a list of organizations we can go through in view of the fact that you don't want to be sending money here and there. You don't want to be sending money which will not be acceptable by organizations that do not have the authority to receive foreign funds. So we want to make sure that that's worked out. If that's okay with people, we will take this question seriously and move on it. Ben, if there's nothing, can I move to Anurag, because we can take questions at the end again.
Let's move on.
Anurag.
Thank you so much, and good to chat with you again, Ameel. This is the third time we are connecting this week. Not happy circumstances. Thank you so much for the work that you're doing with Bath in India. I'll just start with three main points that I wanted to make. Let's step back and let's talk about the scale of the problem. I think numbers, it's been established that numbers that we are talking about are probably understated because of the difficulty of collecting data in such a difficult circumstance where data gathering is hard as is. During pandemic, during a disaster, it becomes even harder, and the numbers are changing. Numbers are almost certainly probably in millions of people being infected every day, and a lot more people dying than the numbers that are potentially being reported. The thing to keep in mind, though, is that what we are seeing is just in a way a beginning or the middle of the crisis. It's not the end is not immediately in sight. people are projecting, some of the models that I've seen talk about the peak reaching sometime in near end of May or early June, but it's not really going to be a sharp peak. It's actually going to be a plateau. We would be at that high level of infection rate numbers and death rates potentially for several weeks after that, maybe even months. So what that means is we're going to continue to see the high death rates and the stress on the healthcare system and the supply chain challenges that we are seeing for a while, even though many of the oxygen-related interventions that Ameel talked about will probably alleviate challenges in the current hotspots. The problem, the pandemic may flare up in other parts of India potentially, and we may have to actually worry about supply chain in those places, which are actually lower acuity settings, tier 3, tier 4 towns and rural areas. As Ameel said, right now it's really Delhi, Mumbai, Bangalore. Those are the places, but I think it's rapidly moving to other parts of India. So it's a massive problem that's not about to go away. What that means is that our response has to be really substantive. Somebody brought up this question about shutdown, the lockdown. It's a rock and a hard place. If you lock down, it impacts. There's a human cost to it. If you don't lock down, there's a human cost to it to that too. So that brings me to my second point. What's the solution here? Frankly, there are not that many effective therapeutics for this. Oxygen therapy or oxygen sort of provision is the only thing that is shown to sort of provide sufficient sustenance for patients who are mild and moderate so that they have a chance to recover. And which is why there's so much focus on oxygen. Prevention would be ideal, but that, as we just said, that might be a bit difficult. Vaccination is the real solution at the end, but we are less than 10%, first shot, less than 10%, less than 2% both the shots. And the supply chain for vaccines is going to remain constrained for several months at the very least, if not until next year. What that means is, we don't have effective interventions that allow us to address this problem in an expeditious manner or in an effective manner in the short term. So that's something to keep in mind. And the third point I wanted to make is that what we need is an integrated approach, and Ameel alluded to that includes primary care at home or near home. It also includes on the other end, tertiary care where we can provide mechanical ventilation and advanced therapies. But as we have seen, these beds are overrun. There's not enough capacity. What we also need then is an intermediate capacity that allows provision of oxygen and other therapies such as maybe dexamethasone in the early stages of the disease, and things that actually allow patients to recover in these potentially temporary hospitals, if not at home. So I think what we need is a more integrated approach to this, an approach that's hard to put together in a disaster situation. But we got to be thinking about that because this problem is going to be sustained. It's going to be pretty significant, and short-term measures are not going to cut it. And that's something that I want to alert everybody to. And the last point I would make, this is kind of going back to the original point about the human cost. Purnima talked about how there's every diaspora member in the Bay Area has a friend, a family member, a neighbor back in India that has been impacted by this. Many of my friends and their loved ones have died during this time. It's I see this on my email inbox and my social media group, my friends group every day. And the grief is unprecedented, and the level of helplessness that our loved ones face in India and on the Bay Area side, on the US side, is pretty substantial. It can't be underestimated. So what we really need, so let me come to the solution part. What we really need is a global response. I think we were a little late to respond to it. Nobody realized how bad this is going to get. I think we were lulled into a sense of relief after the first wave. And I think nobody, not stakeholders in India, but also global stakeholders were ready for it. And I think we we have an opportunity here to come together, the Bay Area Global Health Alliance members, the policymakers on the US side globally, and the civic society that must come together to address this. Somebody was talking about how successful we've been in the last couple of weeks. There's an organization that I am part of, Sewa International, which is a community service organization, primarily works in the US, but has a sister organization in India, Sewa International Bharat. And we have been able to, at Sewa, we've been able to raise close to $10 million for this pandemic response, and we're buying a lot of oxygen concentrators. We've sent about 2,500, another 2,000 are there on their way. Seems like a very large number, but if you look at the need that's there in India, hundreds of thousands of oxygen concentrators needed, especially in the lower acuity settings. We're just getting we're just chipping away at it one piece at a time, and we need a pretty massive response. So the $10 million that we raised is a drop in the bucket as to what's needed. So that's my kind of call to action to all of us here in this alliance and in the community to sort of come together to identify specific areas where we can intervene. And there are 3 areas where I think we can play a pretty substantial role. Number one is provide financial support to help procure oxygen concentrators and other sources of oxygen, not only for the current hotspots, but the future hotspots that are going to be sure to come in the coming weeks and months. So that's number one. Number two is be part of a solution that includes the primary care setting, the at-home COVID care, and potentially even building temporary hospitals. There's a lot of lessons that have been learned from China, from our experience here last year, that we could bring to bear and support India in that. And then third one is helping families and patients and their families in India find resources, whether those are a local supply of oxygen, whether it's accessing hospital beds. And there are a number of initiatives that are going on in the Bay Area in partnership with organizations in India that are very helpful. These involve these helplines that, for example, Sewa's volunteers are working on until early in the morning or late at night. In terms of the at-home care and then temporary hospitals that provide some level of oxygen therapy and intermediate care before you get to the critical care setting. There is a coalition that Stanford has been part of called India COVID SOS. That coalition has now gotten to 400 members. It's growing. We have scientists, engineers, epidemiologists, supply chain experts, manufacturing folks, policy folks. They're all coming together to sort of think about this integrated solution, working with our partners like PATH and others in India to rapidly come up with potential solutions and deploy them on the ground and learn from that experience, because that's what is needed. So those are some of the thoughts that I had, and I'm happy to take any questions.
Thanks a lot, Anurag, for that. You also came up with what needs to be addressed. I know we have a lot of questions, but I wanted to just point people to one thing to keep in mind. Right now, the way I'm trying to react to this is you get a bit overwhelmed with everything that's happening, and you feel like, how can I do something? How can I help? Where can I put my money? Or where can I put my thinking or resources? As for money, I do want to caution everybody. Sarah has put that in the chat, that India has laws, as you know, about receiving funds from abroad. So there are organizations that are authorized to receive that funds, and it's important to go through those organizations, because otherwise organizations that are actually working on the ground are not going to receive those funds unless you work with the organizations that can receive them. We are trying to put together that list and provide it to everybody who's been on this call and our members. We'll put it on our website to the extent we have. Our members are the ones that are providing this information. And as I said, we said earlier, many of our organizations, PATH is one of them, PHI, Google, Facebook, AmeriCares, UCSF, UNICEF, you know, so many organizations that are members of our alliance are already working with their partners and affiliates to support emergency responses. So aligning with them would also be a good idea. Please, as I encourage you to fill in the poll so that we can get that comprehensive review of what's going on and who we can support. But the question will be the three things that you suggested. Who do we work with? That's going to be the question. Financial support for oxygen. Who do we give that money to? You know, being part of a solution, you said, involving home care, which would be some of the organizations that are doing it. Those are the kinds of questions, I think, pragmatic questions that we are grappling with. And I hope we can get to the bottom of that. Ben, I'll stop here because I know you have many questions coming.
We do. It's really good. And thank you, everybody, so much for your thoughts. I'm going to pull the first set of questions around the public health and sort of oxygen needs. And I think these are questions for both Anurag and for Ameel. You know, sourcing oxygen concentrators for families in India, that's something the affluent can do. But what if they invested in an equal amount in long-term work to strengthen the public health system? And that's echoed by a comment from Neelam Feacham, who said, you know, really we need to put an investment in public health. That's the long-term thing that we really need to do. So I guess the first question really about expanding access to oxygen in the context of a strengthened public health system. And Purnima, I think this can go to both speakers.
Okay.
Yeah, Ameel, do you want to take that first, and I'll add some of the thinking that's going on at Stanford and other partners here.
No, certainly this is a very, very valid point. Oxygen concentrators can be afforded by affluent. And in the current pandemic, the cost of these oxygen concentrators are currently rising with the rising number of COVID cases. So we are currently at 2.5 times the existing rate. So it's kind of gone beyond and the reach of middle class as well. So it's actually reached the affluent. So you're very right. It's very, very important that we invest in the public health settings, at least at the primary health center level, wherein people could access even in the rural areas or not so affluent whenever they require. And it's not only about the oxygen concentrators, it's also about peripheral devices, diagnostic devices like pulse oximetry or some multimodal devices around it. So PATH is doing very incredible work, doing an RCT on looking at how multimodal devices could be useful in detecting childhood pneumonia. And one of the countries where this is being piloted is in India. It's a global grant that we're working on, and prior to COVID. And now we actually do not need an RCT to prove that. But yes, investment, especially in the child care, is even more important. So if you look at most of the concentrators, all the pulse oximeters that are coming are not fit for use for children under 5. So that investment also has to come somewhere so that we maintain equity, not in terms of only the financial, but also in terms of age groups too. I'll pass it on to Anurag. Thank you so much.
Yeah, no, that's great, Ameel. I think I'll just mention something about the health equity. I think that's absolutely critical. I think this pandemic in all its waves has really exposed the gaps that we have in access to care in our society, not just in India, everywhere in the world, but definitely in India too. This is why when you're looking to support organizations, focus on those that are explicitly focusing on that health equity piece, to getting oxygen concentrators to the lower tier settings and to the rural areas to institutions, not to homes, but to institutions, because that allows you to serve a lot more number of patients and potentially also build capacity of those institutions in the long term. And I know Sewa's a big percentage of Sewa's concentrators are going to those lower tier settings. Another example is pulse oximeters that Ameel talked about. India is flooded right now, especially in the middle class and upper middle class homes, with these pulse oximeters that aren't high enough quality, and the numbers are the data that you get from that is can be pretty suspect, and I think that's creating more confusion than it's helping. So we need higher quality pulse oximeters that are hard to come by right now. There's a supply chain issue there as well. But the coalition, the Stanford led coalition, India COVID SOS, is actually sending these validated pulse oximeters, high quality ones, to some of those are actually going to rural areas in Chhattisgarh, for example. And one other thing I would add quickly is that India COVID SOS also has on its page, it's not an organization that receives money, it actually channels money through partners. So we have done quite a bit of due diligence on the partners that are eligible to receive the money under FCRA Act. So do look at them. We'll share some of those names with the Alliance, so you can have access to them. But essentially, health equity is a really critical piece. So my recommendation would be to focus on those organizations that are actually focusing on work there. American India Foundation, PATH, JPICO, other organizations, and then a lot of small ones that can't receive money, but they are partnering with others who can. So go to those validated recipients.
Purnima, there's another question, a conversation, in fact, between our very own Ameel and Pallavi Garg. Ameel said, this current wave of COVID was more about managing supply chain, and with data, we would have done a much better job. And I think that's a really critical comment. And it comes in response to Pallavi's question. A gap is also data at the regional, local level, and who is already providing support there? What could we do to streamline better so the aid is directed in a more coordinated manner?
So since I have already responded, I could maybe top it up with an example. So if you see the supply chain of oxygen cylinders, it's very, very erratic. There's no monitoring mechanism or tagging on these cylinders. So we're not very sure how many cylinders actually we have. And how many of them have been held back in people's home or where we are not aware. So maybe an initiative could be to how do we track the supply chain of such cylinders so that the turnaround time for such things are so very important. So I think it's very important that we invest on data building for such things so that supply chain is much better managed. Anurag, you want to respond?
Yeah, I want to just add something very quickly. This is not a short-term, there's no short-term solution to it. We don't have the systems in place. We got to put systems in place, but we can do something in the medium term in the next few months. So many of the oxygen concentrators that are making their way to various institutions in India, they are actually being tagged by Sewa International, the organization that's shipping that, the organization I'm involved with. And those are being, the inventory is being tracked and identified by how it's being used in institutions. What's going to happen a few months down the road is that many of these institutions may not have that same need for these concentrators, but there will be other parts of India that may, and in some institutions it might become a long-term capacity. Figuring out what the needs are a few months down the road and where that inventory should go would be really critical. Otherwise, India will become a graveyard of oxygen concentrators. So we really have to be very thoughtful about what we are doing today and how do we capturing data and how are we tracking the things that are arriving in India and are being deployed so that we can actually optimally sort of reorganize that infrastructure. I think it's an opportunity, I would say.
Thanks a lot. We are quickly running out of time and we have a long list of questions. So Ben, can we pick one and again remind people to keep sending us that information so that we can again share it with the larger group. Ben, go ahead.
Well, if I may, we could possibly just sneak in two here. There's one again from Geeta Rao Gupta that I think is directed very clearly about Sewa International. What does it do? What work does it do in parts of India or with any particular communities? How does it distribute money it receives? How can we find out more about it, Anurag?
Yeah, no, happy to answer that question. Sewa International is a global organization. It works in different countries, mostly works in local communities. So the work that I do in the Bay Area, I'm a Bay Area president at Sewa International, and our work, 90% of our work is here. It's only because of this tremendous crisis that we are having to raise this funding to support work in India. Otherwise, most of our work happens with vaccination, with education, community education, food distribution through this pandemic here in the Bay Area. And that the work that we do is pretty broadly distributed. It's the reports. It's a 501c3. It's a 4-star rated charity navigator, one of the few organizations in our category that has that. So it's very transparent that way. The work we're doing in India is really in partnership with our sister organization, Sewa International Bharat. Which is overwhelmed right now, but they have a set of partners across India. These are institutions, many of them, 30 to 40% of them are actually in lower tier settings, but maybe up to 50%. Very early on, about 10 days back, 11 days back, when this crisis started becoming very apparent to our partners in India, they actually came up with inputs from Critical Care Society in India and other clinicians and their partners, these institutions, these healthcare institutions in these tier 2, tier 3 settings. They identified the needs that India would have, and needs were tremendous, and we potentially could not really serve all of them. But there was a T model to what Sewa is doing for this pandemic in India, and the T model includes a horizontal part of T is food distribution, care for kits for families at home, diagnostic tests at home, and these helpline numbers, which have become flooded with calls actually, and we need volunteers urgently for that, both volunteers here, but volunteers in India as well. So that's really the horizontal part of T. The vertical part of T, and all of this, by the way, is going to be coming through Sewa's social media channels and other platforms, so you can see that for yourself. The vertical part of T is really, right now the focus is on oxygen. So oxygen concentrators, co-venters, which are sort of makeshift ventilators, ventilators themselves. Those are the primary focus right now. But we know that we'll have to quickly migrate to essential medicines, food and sorry, not food, but essential medicines and diagnostics tools, and then ultimately vaccination, help with the vaccination. So that's the vertical part of T. The other thing that we realize is this, as Purnima said at the beginning, the crisis is evolving rapidly, and we don't want to respond to a need that was yesterday. So we're constantly talking to these partners, including the Society of Critical Care Physicians in India, to understand where the hotspots are, what the emerging needs are. One, I guess, positive thing here is that because our effort, $10 million is a drop in the bucket, what we've raised here, it's such a small percentage of what India needs. No matter what we do, it's actually serving the need that exists, even if we don't get it precisely right as to what the needs are on the ground. But I think we're trying our level best with the limited data that's available. We have our own sort of biodesign inspired needs finding that we're doing across different parts of India, kind of tracking it on a daily basis, so that we can weave that back into our vertical part of the T. Horizontal part of the T is needed across all of parts of India. The vertical part of T is actually what is going to evolve pretty rapidly. And that's where we need to be much more responsive.
Okay, well, thank you, Anurag. I've got one more question, Purnima, which I think goes to you.
Ben, we're almost out of time, unfortunately.
Well, I know, and I think this is a marvelous question to help you wrap up.
Okay.
And it's from our friend Brazy, Barbara de Zalduondo.
Zalduondo.
Yeah, and it's really about the hesitancy, the politicization of recommended responses, and ultimately, what can I do to help and where do we go from here? And I just thought, Brazy, thank you. That was just such a nice way to tip the ball back to Purnima to close us out.
Thank you. Well, I'm going to address the latter part. I mean, this has made it very clear, this particular discussion, that we have a lot more to discuss. And already I'm seeing in the chat box from Pallavi and others that we need to have this dialogue on an ongoing basis. we are not going to get all the answers in this one. So, you know, along with the Alliance's efforts to put together the list and what organizations are doing, we're going to have to stay in touch with local efforts that are being made. We heard from COVID SOS that there is a call every evening at 7 o'clock. They encourage people to come together and talk about what can be done. That would be another way to figure out what it is that we can do, because each of us has different capacities. Each organization can do different things, but we are all needed in terms of this response. And I want to just end with one thing, because we have very little time. First of all, thank you to everybody for coming together. We will do one more briefing, I'm sure, maybe a series of briefings, I don't know, because this kind of surge is now starting to happen in other places as well, but India is particularly dramatic. While we are focusing on the immediate and what's happening today, let us not forget what is, you know, going to be continuing. The needs of, for example, we are seeing violence increasing among, you know, domestic violence and women. We're seeing children, you know, being exploited. There are all kinds of other things that are happening that many of our organizations are involved in. We need to continue to do that work as well. So I just wanted to flag that. And again, thank you very much. We'll take some of your questions and bear in mind what the focus of the next you know, sort of round of this kind of discussion is. This was an emergency briefing put together quickly and very kind of Anurag and Ameel to participate, and all of you. Thank you so much. Bye-bye.